How did you know that there is an infectious disease caused by a bacterium which is spread by ticks? The most common sign of the infection is an expanding red rash known as a erythema migrans that appear at the site of the tick bite about a week after it occurs. In today's show, we are diving into Lyme disease. We will learn about acute Lyme disease versus chronic, people who are likely to contract the disease, as well as how it occurred. Are you ready for another chronic pain conversation? Let's go. Hello, and welcome to Chronic Pain Conversation. My name is Kalila, aka The Overcomer, and this is my lovely co host, Miss Sharifa McLaren. How are you doing today?
I'm doing okay. You sound a little raspy though.
I am raspy, honey. So let's get into that today. We're going into a little pain or pleasure, aren't we?
Yeah, let's go. Let's do it.
Okay, so Mama, talk to me today. What's up? Pain, pleasure, Well, you smiling like tomorrow. So a
um,
pleasure.
I'm a little bit of both today.
Okay.
It's a gloomy day outside, a lot going on, a busy morning, but other than that, I have no complaints. I don't have any aches or pains, so I guess that's the pleasure side of things.
Well, I'm glad. I'm glad that's happening for you. Oh my
Kalina,
God.
you don't sound normal today. So what is up?
So, it is actually, ladies and gentlemen, I'm in some pain today. It's really funny. I'm pleasure because I'm back in Cali, but the trip, it tears your body down.
Mhm.
What had happened was, I decided to drive this time instead of fly because flying sets off my seizures and really gives me flare ups.
Mhm.
And sorry. And what happened was is with everything that's going on with COVID, trying to get someone that's able to travel with you and take what do they call it? Quarantine time on both ends is like really, really hard right now.
Right.
So me and my family decided that I was gonna drive down and make it a lot easier. Now, one of the things that we always talk about is like giving your body time to relax and set through the next day. But I drove through Colorado and then ended up in Vegas. So I ended up from 1 degree with snow to 22 degrees. So I'm guessing that I caught something in that moment, but I lined myself up so that as soon as I'm dealing with I came in and I was like, I'm getting a little scratchiness. And Sharif, if you know me, as soon as anything starts hitting my body, what do? I'm on it. Like, we don't have time with our chronic
Right.
pain. What
Right.
can be small can be bigger. So I always, as soon as I feel like anything that feels like flu like, not COVID like, flu like, you know, I'm pushing it out. So literally, I've been in bed for 2 days. The day I went and I saw my masseuse on Sunday, and she did Reiki on me and she massaged me. And Sharifa, if the amount of stuff that just came out of me after 24
Wow.
hours was ridiculous. In fact, I came home and she's like, "You're gonna be tired." Like, I think what the thing is people think that massages are gonna just like relax your body, but a real RMT, a good massage, it's gonna crank out your knots. It's gonna make sure that your energy is flowing. It's gonna make sure a lot of things are happening, and it's gonna drain you. So I was like, okay, and I fell asleep on my heating pad. Honey, they needed to change the sheets the next day. I woke up, and you would have thought that I took a shower in my bed. But
Wow.
this is the thing, like, some people might get in this place where it's like, okay, well, this is serious. But no, one of my issues has been excessive sweating with the fibro since the accident, right? So this makes sense to me. Like, some people are like, it's urgency, and it's like, it's not. It's urgency for me, but it's not as devastating. Fibro and chronic pain can elevate what's going on.
Right.
And then I saw my chiro yesterday, and oh my gosh, people, when I tell you that, like, we try to take antibiotics and they last 7 days. This chick, between the two of them back to back, like everything that was over here is now like back up and it's just here.
Mhm.
And I've just been resting. Like I feel like my energy's coming back. I've been on my broth, but um it's left my body a little bit of ailing, not a lot, but it's a combination of the traveling, of the
Right,
weather.
right.
But that don't really matter today. I've been talking too much about my pain. That don't really matter today because today we talking about Lyme disease. Today we talking about educating our people. And
Yep.
I'm actually really excited about this because when we were doing our research on it, we had some really good conversations in the back end.
Right.
So, like, take us through this. Like,
Okay.
this was you, Sharifa. This was like when we were going through things, you were like, I want to do Lyme disease. Talk to me.
Okay.
Tell us why you wanted to do
So
it.
okay. So this is my thing. I'm gonna be totally honest. When I was looking up Lyme disease and like just trying to research different things about it, I cannot even lie to you. I was starting to like itch a little bit and felt like, because I thought, hey, and I was mind blown to know that like things that we hear about, like everyday kind of bugs, like cause an actual disease to happen.
And well, you got to think about it. Like, we know that rodents, we know that animals, we know that there's rabies, we know that there's all these other things. So we know that there's definitely, that bacteria travel. Like that's how we get sick in the first place. It's bacteria from one being
Right.
to another. Okay, so
Right.
go on.
Okay. So did you know that Lyme disease is more common in males up to age 15 and between the ages of 40 to 60?
What?
So, yeah. So basically, the males that are affected are people who are more likely to play outside, go camping, which Cleela we love to do,
The camping.
hunting and hiking.
Well, you find ticks on those kind of animals, and that's the area. That's where ticks live. So
So
it
that
makes
so
it makes
that so that exactly makes sense, right? So for the most part, Lyme disease looks like this. I'm going to show a picture. I'm going to share a little picture. Lyme disease looks like this. So it looks like a bullseye, right, Kalila?
wow.
And so it's a side picture, but nonetheless, the middle part is where the initial tick would have latched.
Okay.
And it needs blood, but we're gonna get into all that stuff after. But that's what it typically looks like. You have, the bullseye, and then you have like an outer ring to it, or whatever the case is, whatever you want to call it. But that's typically what it looks like. That's a visual sign of
Right.
Lyme disease, pretty much.
Okay. It's really funny because there was a point where we were talking about it. I was like, yeah, I've had that. I was like, no, wait, no, that's bed bugs.
Yeah,
No.
yeah.
But bed bugs and ticks almost look the same to me.
And that's another thing. They can also be mistaken for another insect. So there is a difference. There really is a difference.
Okay. So, do you want to talk about stages? Can we talk about the different
Yeah,
stages
let's talk
about
about the different types and stages of Lyme disease.
Okay, so to our knowledge, there are three stages. That didn't look like three, eh? That's three stages. So the first one is the early localized disease. So these are the symptoms where, it's acute. And Lyme disease may begin hours or a few days. And this is what's interesting. Like it can be in your system and it can allow hours, days, or weeks
Yep.
after the bite. And at that point, the body has the infection is not yet spread throughout the body,
Right.
and it's the easiest stage in which it can be cured. But then you've got stage 2, which is the early dissemination of the Lyme. So you may occur that, and this is what's interesting, weeks or months after the bite, and the bacteria is beginning to spread throughout the body. And then you've got stage 3, which is the late dissemination of the Lyme disease. And that's the place where, if the Lyme disease isn't properly or effectively treated in the first 2 stages, this late dissemination, this post treatment, or where it's chronic, this is where it comes into our conversation today, or neurological, which is really crazy, occurs weeks, months, or years. We're talking years after the tick bite. Like this is why it's chronic. right?
Yeah.
And the Lyme bacteria can spread throughout the body, and many patients develop the chronic arthritis as well as an increase in the neurological and the cardiac symptoms. So we're talking neurological brain, we're
Brain.
talking about cardiac heart, and you're looking at us, and if people saw our flyer, that takes like
it. You know what? It looks a bit bigger in the picture, but it is as small as a poppy seed.
that's the thing about it. Something that's as small as a poppy seed can affect you for years.
Yeah, cause so much problems over time. Ridiculous.
It's freaking ridiculous. And it's, I think what was really interesting is that when we were looking at this, you know, to our audience, the reason why we wanted to bring this on was because, you know, when we talk about chronic pain is defined as anything that is 3 months that is consistent for over 3 months.
Right.
So when we're talking about this, you know, even in that early stage, it's talking about days, months, weeks, right? And it's really crazy. So what kills me is to go like, could it be, and this is my question as a fibro fighter, because I'm still investigating
Right.
if my diagnosis is only fibromyalgia or not, which we need to talk about later, my love. But could you possibly have Lyme disease? Could you have gotten a tick? You know what I mean? That got you a bite that's leaving you, because once you go into these symptoms, there's a lot of symptoms that are very similar to other chronic pains.
Okay.
Oh, you're smiling.
No, I'm smiling because I do remember reading something. As for the visual, because we're talking about what if, right? For a visual, as I showed you the bullseye diagram, what it looks, right?
Right.
Let's be honest. What I read was kind of true, that visually, depending on your shade, African Americans cannot visually get a symptom or can't see it visually.
Wait, because, straight up. You're telling me that me and you can go camping, catch this disease? Okay, well, I'm light-skinned.
Right. That's what I was about to say. You could probably tell if it was a tick and say, hey, this is what it might be. But me, I'd be scratching my head and probably have to do further tests, and I can't just see and say, okay, like maybe this is what it is.
Points for the light skin.
But I was just thinking about it. Yeah, I was thinking about it, and I was like, someone like me may have a harder time trying to pinpoint what a rash on my foot might be versus someone of lighter skin color.
Because you don't really get the rash. You don't really get that. It's the pigmentation in your body that really won't turn.
Right.
Whoa.
So something to think about. Big up to all of the light skins, though. I love y'all. Oh, Lord. Okay.
There are so many shades of black. I love it. Okay, talk to us. I'm sorry, you got me crying over here.
Oh, we already went through the cause, which is a bacteria. The bacteria is actually called, ready for it, Borrelia burgdorferi. Borrelia burgdorferi. Okay, that's the name of the bacteria that the ticks carry. So it's spread through the bite, right? So now there are actually 2 types of ticks that can spread Lyme disease. And funny enough, guys, Lyme disease is actually more common in Canada. So, yeah.
Why?
Honestly, and you know what? When it said camping, hunting, hiking, all that stuff, where do we live?
Yeah, but you can't say that, because when you go through
You're right.
Oregon, like Huntsville,
right. They have those kind of, you're right. But that's what I saw a lot of similarities in saying they're mainly found in Canada.
Now, is that because we have more north? We have more greenage than the States, I think. Like the States has where once you get past a certain place, we just got green desert, like not desert, but prairies and all that other stuff. Okay,
and I also wanted to think, is it because of maybe our change of weathers too that things breed more? Could that be a factor?
What do you mean? Explain that to me. I like your thought process here.
Okay, so let's be Caribbean for a second. We know how mosquitoes come about, right? When you have that, after rain, you get those puddles and it breeds mosquitoes and all that stuff, right? So I'm thinking, I don't know what breeds ticks, don't quote me, but I'm just thinking nature and even how they come about. Could it be our change of weather? We're going from hot, we're going to cold, we're going from,
if we breed a lot of flies up here. We do. We really do.
So I'm just thinking, I'm not saying that's what it is, but it's just a thought process as to how they, come about. Nonetheless,
Okay.
There's the black-legged tick, right? So that's found in southeastern and south central regions of Canada. And then you have the western black-legged tick, which is found mainly in British Columbia. Okay. So those are the two main ticks that carry that bacteria that infect us as humans. Call it that.
When you go for your camping, and this is why it's really important that when you go camping, you need to know the area that you're going camping in and the season you're going camping in. Because I know that black-legged one is called deer ticks, which is something that you see a lot on when they have them on the cans. And you can't have mosquito spray for deer ticks. It's not the same thing.
100%.
Okay.
So of course, as I said, ticks need blood to survive. So they'll attach on animals. We hear of dogs getting ticks. We see the commercials about anti-tick things for your pets and all that stuff. And so it also, us humans, we have blood, so it'll latch to us to feed, right? So once infected, ticks can spread the bacteria to humans and pets, particularly dogs, like I said, and they need to feed for at least 24 hours before the bacteria can be transmitted.
Okay.
So, I mean, some people may think that's a long time. That's really not a long time, only because of what you had told us, Kalila, about people going days or weeks without even knowing that.
Like they're saying that the sign might not even show up until, so you'll have it in your body and you don't even, like, I think about chickenpox. I think about all of those things where you actually have the disease in your body before you actually see the symptoms.
Right.
Okay.
Right. So again, ticks are as small as a poppy seed, you guys. So think about your poppy seed muffin or something. Those little black things, that's how small a tick can be. So technically it makes sense why you would go such a time not knowing, because of how small it is. You may not feel it and all that stuff. So it does make sense because of the size. Can you imagine, Kalila? Like go ahead.
Like we could literally have chronic pain conquerors on here right now because, and this is why I always say, fight for the clear understanding. While I appreciate the definition of fibromyalgia, I want to know more. And this is a very good point because, you're having chronic pain. Like we're going to go into the different symptoms of it. But what happens if you get a misdiagnosis? What happens if I sit there and I watch some of these shows, these medical shows, and, someone might be diagnosed with fibro, but what happens if you have Lyme and it just takes the right test to find it out? Now, here's the other thing. People, me and Sharifa were having this conversation. This is why it's important to get your annual checkup, right? Because what happens if you've had this in your system for 6 months and you don't get your annual checkup? That annual checkup is when you're getting your blood test and getting all of those works. And they're looking through your body head to toe. This is the importance of an annual checkup.
And Kalila, when I was telling her how long people could go without even knowing about this, she was like, that don't make no sense. How can you go that long? You would find out during your annuals. I had to remind her, not everyone goes for that annual.
Hey,
people go, I'm sorry to say, but people go years without the annual. I personally know people. So when I tell you, it can happen where they don't know they're suffering with something or have something for months or years. Yeah, people don't go, Kalila. So Kalila's right. Go for that annual. Even if nothing comes out of it, at least you had gone.
And it's what we need to understand is that annual is knowledge. It's power. It's giving you freedom. It's giving you understanding. It tells you if, and it could be something as simple as, okay, so really just like coming off track for a minute, but like even today when I'm talking to you about being sick, so I wasn't actually this bad yesterday. After I finished my treatment, I was better. However, I came back home and my body was hurting me from the treatment, which is what's normal, and I smoked my medicine, right? I had my medical marijuana. And then I realized that was the stupidest thing that I could have done because I'm having the issues here, and the smoke is now causing reactivating all of this crap. Right? Knowledge is power. You may be doing something to hinder your health, not going to your annual checkup. And I'm not gonna lie, like I'm down in the States, and while people might be like, oh, you know, in Canada you got OHIP and you're this and this is covered, and I'm paying for my medical expenses down here while I'm in the States. But people, your body, your life, your health, it's an investment. It's how you survive.
Yep.
If you have Lyme disease and you end up in stage 3, you could have fixed this at stage 2 or 1.
Yep, and we're gonna get into that. Yes.
Okay, come on, talk to me, because I'm. You know how I get passionate about people.
I know. Okay, so let's get into the symptoms.
Okay, talk to me.
So I'm gonna go by the stages. So when we're at stage 1, Cleela had mentioned early localized disease. So that you're gonna possibly see a skin rash, which may or may not look like a bullseye, but most likely it's that bullseye look. Flu-like illness, including chills and fever, fatigue, headache, stiff neck, muscle soreness and joint pain, swollen lymph nodes, and sore throat. Now, with that, anyone hearing what Kalila's going through may say, oh my God, it's Lyme disease. But with that, we have to be careful because some symptoms are similar to other things, which is why what Kalila said, it's better you get your test done to narrow it down.
Can we stop for a minute?
Go ahead.
Because I'm sitting back and I'm sitting here and I was like, do you realize flu-like symptoms, fatigue, head and neck, sore throat? These are COVID signs, people.
That's why
we're living in a time where every little thing gets you like, oh my God, it's a COVID. Oh my God, don't touch me. But here's the thing about it. Right now, we're social distancing. What is everybody doing in the summertime? Like, it's hard to get camping spots right now simply because it's one of the only options that you have in order to really enjoy yourself. So now what happens if you went out camping last year or you're planning to go out camping this year and then you come back and you're thinking you got COVID symptoms and you don't, you got something like Lyme disease.
Right.
And it makes it even, here's the other thing. Do you know, I'm going to ask you and I'm going to ask our audience, swollen lymph nodes. Do you know what this is? Because this is what I'm investigating right now with my body.
So correct me if I'm wrong. Lymph nodes has to do with like your neck area, no?
It's not just your neck area.
Not just your neck.
It's not just your neck.
So
it's part of that inflammation of your lymph nodes, and it's not just your neck. It can be in your body as well.
Okay.
Like it can be those fat cells. It can be all of these different things that are hurting. And so, your lymph nodes, like most people think about here, like when you're now, my lymph nodes up here are swollen, right? But I've got lymph nodes at the bottom of my feet, in my legs, it's everywhere. There's those little bumps. They're the fat cells that then end up getting, and that's where the chronic pain is coming from, because your cells are being overly sensitized from trauma. And trauma doesn't need to be a car accident. Trauma can be that little sucker that bit you, right?
It's a poppy seed.
The little poppy seed. Now I'm going to be like, watch, does the poppy seed move? Does it move? Don't eat poppy seeds when you go camping. And if the poppy seed moves, dash it. Okay, sorry, going to stage 2. I'm having fun right now.
Okay, so stage 2, which was early mentioned, was the early disseminated Lyme disease. So basically everything that you would experience in stage 1, you would experience pretty much in stage 2. Adding to that, you get pain, weakness, or numbness in your arms or in your legs. Your vision changes. You get heart problems such as palpitation or chest pains. And then you even may get facial paralysis, which brings us to another word, Bell's palsy. But that's not today's conversation. Can you imagine, Kalila, just at stage 2, all of that could happen to you, including face paralysis?
You can have heart problems.
Yeah.
Listen, people, this is why I talk about getting more than one reference, getting more than one. Like, I'm not, like, the amount of things that we are learning through this show. I am so thankful that we've been doing this show, Sharifa.
Definitely.
But can you imagine, like, you're sitting there and you're like, you got pain, and like, there's people that are like, my body hurts, I'm pain, I'm weak. And it could come down to your skin color. It could be like where you got bit. You know what I'm saying? Whether or not that sucker shows up as a bullseye or not, whether or not you go to your doctor and this is really important, why you got to tell your doctor about everything.
And I think with this as well, you have to act on something like this, because if you think about it, am I going to be here looking at my skin? Like, how many surface area do I have to go through to see if it's a tick? You're not seeing this thing. Let's just be honest about it. So I think that goes to show, like, when we see something's wrong, we just need to act on it. Even if it turns out to just be a cold, I think it's safe to say, just go get checked.
So for those of you that know me, you know I love my driving. And I was talking to someone, like, I have a couple of friends they love their cars too. And, you know, as soon as our babies have, you know, she smells wrong, or, you know, she's got a flat tire, or we're not waiting. Listen, we on every 5,000 clicks, that baby gets changed. Why? Because we're trying to be preventative. Yeah. There's people that won't get their oil changed for 6 months.
Yeah, I know.
And they kill. You guys need to not do that. There were so many things in your life. Like, if it was your child and your child sneezed, you're off to CVS, you're off to Shoppers Drug Mart. Like, let me get the medicine. Why won't you do that for yourself?
Kalila,
I'm sorry.
Stage. Don't be sorry. Don't be sorry. Our last stage, which is a late disseminated Lyme disease.
Right.
All of those symptoms prior to, but now we get into more severe stuff. So we get more severe headaches or migraines. You get vertigo or dizziness. You get a stiff or aching neck. You get insomnia, so sleep disturbances, mental fogginess or concentration issues. And then we have severe fatigue, where you're just tired to do anything, problems in like following conversations and even processing information, because then we go back to the neurological side of things, right? Because your brain controls all that. You can't hold a conversation.
There's a bacteria in your system and your brain's trying to fight it.
Right. So I don't know. I found it so funny. We were kind of figuring out if we should do Lyme disease, and for some reason I'm like, let's do it. I don't know why, Kalila, I told you let's do it, but as we're going through the show, it's just like, I'm thankful we did choose to do this topic today.
I'm ridiculously scared right now, Sharifa, because the more and more you talk about the different stages, sorry, you guys, the more and more I'm like, these are signs of fibromyalgia, right? And these are where I get scared, because, you know, we hear a lot of patients that say, well, I got diagnosed with fibromyalgia, and then they stop.
Right. They don't go further with any other thing, because that's what it is.
They don't go for any other thing. But honest to goodness, if someone was listening to this and we wrote down these stages, they'd be like, I got like 60, 80, 90. Truth be told, Sharifa, there's not one symptom that you put down there outside of the facial paralysis,
right?
Or like the vision change happened, that hasn't been associated with my fibro. You know what I'm saying? Like, thank God, I know that I don't have this, but for someone that
it
does,
just goes to show it can overlap. It can overlap.
Now, this is what's going to kill me, because treatment and medication and therapy is like what blows my mind. Like when you told me that it only takes 14 to 21 days of course of antibiotics, it's what's usually recommended to like reverse this. So you tell me you could be sitting down there for years, for months, having blurred vision, having sleep disturbances, having cognitive problems from a little sucker that's a poppy seed, and it can be reversed within 14 to 21 days.
Right.
And in up to 90% of the cases, the antibiotic can cure the infection. And without treatment, the symptoms can progress. Right. And it makes me mad while we're having this conversation right now, and it makes me scared. It makes me so scared. Sorry.
I know, don't worry. I think it's finicky, because then you have people who don't show any symptoms until how long after, right? But then I'm also seeing, oh my God, there's an illness that's, let's call it, it's curable, of course, if it's treated in the right amount of time with the right medication. And mind you, let me just let the audience know that there are different antibiotics that could be given. So it's not just one antibiotic. There could be different ones. I guess, people react differently to different things, and that's where you have that discussion with your doctor and they recommend the proper antibiotic to give you. But it's finicky to me, because what if someone doesn't really show those symptoms? Like, then how do they know that they should go and get that, that doctor visit to get that antibiotic to cure that Lyme disease, right?
That's where the annual comes into place.
True.
Because your body gives off signals. Mm-hmm. There have been so many times where they've just sent me for the blood work, which is the initial I didn't know that I had the alpha thalassemia until they actually did the blood work to really look at it, right? I didn't know that there were certain things that were going on with me. Like, I didn't even know, Sharifa, that you can get a blood test and your blood test will tell you if there's or if there's inflammatory diseases in your body.
Oh, you didn't know that?
I didn't know that.
Oh, I get those done all the time for my lupus to see, I get a blood work done and it'll tell me if my lupus is active or not active. It's that simple.
And that's what people don't understand. Your body will tell you stuff.
Yep.
Go to the people that have paid good money to study, to be able to know these things so that they can tell you.
I feel like this is how I feel. It might sound funny. I feel like if I know I'm going camping in June, the week I come back, I'm going to go get a checkup, a blood test.
Don't do that, because the thing about it is it says the symptoms can show up days or weeks afterwards.
Yeah.
Don't live your life scared.
Yeah, for sure.
Live your life understanding that there's resources.
Yeah.
That's what you need to understand.
Yeah.
And if your body, so for example, same thing with this, my body started getting a little scratchy. What did I do? I started taking the overproof started using my sage. Mm-hmm. But when I could see that I wasn't able to fight it on my own, what did I do? I went to my resources. Right. My resources kicked the butt out of it. You know what I'm saying?
Absolutely.
Stop thinking you're going to be a burden to somebody.
Absolutely.
Stop thinking that, you don't have that money for it. Stop hindering your success in your health, because that's what this actually is. Being successful with your health. And if you're not successful with your health, then just take a knife to your neck right now, because you're just reducing your longevity of life with your family and friends. That's what it really comes down to. Because if you sit down there and you got Lyme disease for a year or two, how many months, occasions, special occasions, birthdays, all those different things have you not been able to participate with your loved ones?
Yep.
It's you're looking at me like, what do you mean take a knife to your throat? It's taking away from your life.
Absolutely right. You're absolutely right. I mean, And the thing about it is, like, something that small, I think the most surprising thing to me is that something that small can go as far as to cause, like, inflammation of the brain and spinal cord. That right there, Kalila, let's just be honest, that's our life.
Damn it, COVID doesn't do that.
That's our life. But apart
we sit here scared about COVID, and you can have worse effects from Lyme disease than you can from COVID.
Yeah. Yep. That's just what it is. Nonetheless, Kalila. Okay.
Yeah. Sorry.
Let's get into some lifestyle changes and remedies.
All right.
So, when dealing with Lyme disease, we have to remember our body helps to fight things, and we got to help our body fight certain things, right? So I feel like if you're taking antibiotic for anything, let's say you're sick and you have a cold, right? Kalila, are you going to be taking medicine but still feeding your body junk?
Can you say that one more time?
Oh, sorry. I'm saying, let's just say you have a cold. Doctor gives you antibiotics. Are you still going to be feeding yourself junk? Are you still going to be drinking pop? Are you still going to be eating cake?
The answer is no, but we do it because we don't understand that they go hand in hand.
Right. So with that being said, even though, let's just say, praise the Lord, we got to the doctor on time, we're taking antibiotics. We still need to be mindful of what we're taking into our bodies, okay? So let's try to avoid the following. We got sugar, processed or packaged food with additives and like lots of processed ingredients, saturated fats, trans fatty acids, and hydrogenated fats. Anything that's hard to digest or makes you feel bad when you eat it, just stay away from it. Now, this is where me and Kalila were like, high fiber food help to keep your intestinal tract healthy. Healthy digestion and good bowel function is critical when you're working to resolve Lyme disease or any illness. But Kalila had a good point. Kalila, do you want to share your point with them?
Okay, so I was like, hey, high fiber is great, but I got IBS, I've got GERD, and I've got hiatal hernia. So when we talk about high fibers, that high fibers hurts my body.
Yeah.
So now we're talking about, having that healthy digestive system and having the good bowel movement. But this is why we had that conversation with the nutritionist. Go back to the end of season 1 when we talked with Carolyn from the Energy Shack. This is why it's important to have a nutritionist. Yeah. This is why it's important to use your resources, because when you talk to, and this is the difference between a dietitian, right? The dietitian is only looking at, well, how to change your lifestyle so that you're losing the weight. Right. The nutritionist is looking at how to deal with all of your diseases and all of the different things and what's good and what food will heal you. So as much as you might not be able to, like for myself, I might not be able to have those heavy greens, but she'll load me down with certain shakes and certain foods and certain, greens. She'll know which greens to give me the high fiber, and she'll know how often, because I could do this, think that I'm about to help myself like I did yesterday and had my marijuana, and I hinder myself. Right. I'm sitting in the coffin and this was gone yesterday. Right. This is what we talk about. Consult a nutritionist.
Absolutely. Okay. For me too, I can't take high fiber. So it's good to, like, if you know you're already dealing with something, to consult a nutritionist, even consult your doctor and, have him refer you to someone who can help you with that process. Some nutrient-dense anti-inflammatory foods, because remember, Lyme disease brings on inflammation, right? So we want to know that, we're having our leafy greens and our vegetables. Our berries are very vital to inflammation. And of course, your healthy fats and omega-3s like avocados, salmon, flax seeds and flaxseed oil, or whatever the case is that you take. Keep those in your diet. It definitely helps fight the inflammation, because inflammation, I feel, comes with a lot of illnesses. A lot. Like, that's one of the common denominators. So it's just best to keep that in your diet consistently.
Yeah, it's really funny, because here's the other thing.
Mm-hmm.
You know, we were talking about coping and support, and you know, you wouldn't think that after having a conversation like this that there would be a lot of coping and support.
Mm-hmm.
And it was funny. I pulled up Facebook and I
Yeah.
found like at least a good 30, 50 like Lyme disease and being pregnant. Like I was like, whoa, I didn't even think about that. You know what I mean? Lyme disease and for women, or you know, chronic Lyme, because there's some people, like they said, there's that 10% that can't get away from it. Your autoimmune diseases and Lyme disease, how the two of those go together. You know, there's a lot of different groups on Facebook
Mm-hmm.
that, and I found that Facebook tends to be that place where you can get that supporting group from
Right.
all over the world.
Right.
But
Right.
there are groups and there's people that will teach you coping skills. So I want to give a shout out to all of those people that, you know, they apparently had this experience and they decided they were going to make groups for other people and educate and support them. There
Definitely.
is support out there for you if you want to start asking questions. If you want to learn more about it, there's articles about it. And that's the other thing that we keep talking about when we're talking about coping and support: be resourceful.
Mm-hmm.
Right? Yeah. So tell
We
us about the specialists and the associations.
right. So I like what you said though about being resourceful. Like you can't rely on everyone to give you everything. The easiest thing, guys, that we all have at our fingertips is Google. Just put the word in and a bunch of stuff comes up. And just take your time and go through and do your research. Two that I did find that I really did like was one, the Lyme Disease Association,
Okay.
referred to as the LDA. They're a nonprofit, a charity focusing on research, education, prevention, and patient support. So if you're a new person, you know, just got diagnosed with Lyme disease or whatever, going through the motions or, you know, whatever you're dealing with, they are a good place to go for education and help. Um, Another one that I also did like was CanLyme. So that's Canadian Lyme Disease Foundation. I don't know if I was being biased because I'm in Canada. Um, but it's provided, it's formed to provide the public and medical professionals with balanced and validated information on Lyme disease and related co-infections. So even doctors can go on here and can go on here and get information, things that they may not know or, you know, want to refer their patients to. They can get that information. So like Kalila said, guys, it's about you as well doing your own research. You know, go Facebook, Google your doctor. Something must point you, or someone must point you in the right direction, right?
Okay. Okay. All right. Well, let's close this off because we had like some. I got intense today. Thanks, Sharifa.
You know what? You know what? You have to admit, doing Lyme was a good show. I think it was really good. It
It was
opened my eyes.
informative. It was good. You know, what's really funny?
Mm-hmm.
You know, we talk about some coming off topic right now, but we talk about goals and we talk about success and we talk about leaving our legacy and all this other stuff.
Right.
I can't wait for the day that, and after redoing all of these shows and getting all of this information,
Mm-hmm.
being able to have a very random conversation with somebody in the future. And we're going to be like, yeah, I did a show about that. And they're gonna be like, how do you know about this?
And the number one thing is the confidence that we will have carrying those conversations.
Like, I am.
Are you a doctor? No, definitely not. But
No, but we've been, and we don't know everything, you guys.
definitely.
Let's not play.
Yep,
But
100%. We don't.
the whole point of chronic pain conversation is to start the conversation,
Absolutely.
is to give you resources, is
Mm-hmm.
to give you information and to give you power.
Mm-hmm.
However, it doesn't stop there. The same way when you go to church and you might listen to the preacher, you still need a relationship with God.
Yeah.
Is the same way that right here, while we giving you information, we're giving you places and information to continue to investigate
Mm-hmm.
and then have the right effective communication with your physicians
Absolutely.
and your doctors
Mm-hmm.
to help you.
Absolutely.
Right? The power's in your hand.
Yeah.
The power's in your hand.
I think with that, Cleela, it's time to get into our keep it moving moment. And I think after what you just said, it's perfect.
Okay.
Here it is. You were given this life because you are strong enough to live it. No, you were given this life because you are Kalila. You were given this life because you are strong enough to live it.
I'm going to make that one of my overcomer postings just for that.
I love it. I love it.
I love it. And we have this conversation. I'm going to go into closing thoughts right now, but
No
I
problem.
love it because we go into this place while we're like, woe is me. And, why is everything happening?
Yeah.
You guys, as much as I hate having my fibro, I will not hate being the advocate and the trailblazer for this community.
Yep.
And if that's what I had to go through in order for it to make me strong enough to put me in front of this audience, and I say that because I know that there are a lot of you chronic pain, and I keep using the word conquerors, because every day that you get up, you conquer. Every time you move, you conquer.
Absolutely.
Every time you push through the pain, you conquer.
Absolutely.
But the life that you live right now is not just about you. It's not just about your family. It's not just about your kids. It's how you influence your mom and your dad, how you influence your neighbors, your coworkers, through everything. So if you're going through something right now, whether it's Lyme disease or another chronic pain, you are strong enough to push through it if you're willing to find the resources that will help you. The same way that when you're hungry, you go look for food. If you're willing to go and understand that this may be a challenge in your life, but you will rise like a phoenix from the ashes.
Yeah.
Live your life. Yeah, that's me.
My final thoughts, of course, I agree 100% with everything you said. I'm a strong believer that everything happens for a reason. And even with that being said, like, God gave me this opportunity, like he said. And so if he's given this to me, it's for me to find a way to use it. Not woe is me, like you said, but to use it because, like, I think it's self-motivation to know that you can do it. You can push through. And I feel like this episode to me has taught me personally that it's not about the big diseases. Lyme disease is not big. Let's remember, it's a poppy seed size that can turn into a big thing. But I think, like we always say, don't hesitate to, go get things checked out. Get your annual. Like Kalila said earlier, you can go a period of time without knowing certain things. Getting the annual can save your life. Asking that one question can save your life. So let's continue to do what we have to do for ourselves and live the life that we were given.
Yeah. All right, Sharifa. As normal, we get so passionate, and I'm okay with that. I'm really okay with that.
100%.
But that's our show, guys. I am Kalila, the Overcomer.
And I'm Sharifa McLaren Thomas from YouTube with Thomas Life.
Thank you for joining us for another episode of the Chronic Pain Conversations. We'll be back next week. Now, people, let's just take it for a minute because you see this. Okay, you see this woman. Wait, you see this woman over here?
Guys, honestly, it's weird on this platform because the things we see, it's not how it is. So yeah, you got it, Kalila. You got it.
The woman over here.
Oh no, this side. There you go.
She is having a birthday next Tuesday. What? And on top of it, you guys, we are talking about, we're going to go into, what are we going into next week? Fibro. That's why I'm excited. It's a double whammy for us. It's like we're talking about me, but we're celebrating you. This is so great. So, you guys, we just want to say that make sure that you follow us on Facebook, YouTube, and Instagram at CP Conversations. And if you are a chronic pain sufferer who would like to share your story, we invite you to be our guest. We are looking for people that might have muscular dystrophy or scoliosis or sickle cell anemia. If that is you and you have some of those things and you want to have a conversation and empower people and enlighten people, fill out our guest form. And, just remember next week's going to be awesome. Come with your, I got to figure out what I'm going to do for your birthday that's going to be so special.
Girl, we coming on the show. That's what we doing for my birthday. We coming on the show.
Girl, I don't even know. Maybe we just need to have a 1-hour party session and just be like, ooh, ooh.
I may just to warn you, come with like a bottle and no, I'm joking. I won't do that.
I'll come with a bottle. Shoot. Maybe we need to just dress up and be in our finest next week. We're gonna have that conversation.
Honestly, maybe.
I got my little black dress. I'm ready to go.
We'll surprise them.
We will surprise you. So you need to be here next week. It's your two girls, people. It's the Overcomer. It's Miss Sharifa McLaren. Let's have a ball. Have a blessed day. Have a blessed week. And remember, Chronic Pain Conversations is the show that enlightens and advocates about chronic pain. Yep. Share the news, share the podcast, share everything that we're doing. We love you. We can't wait to see you next week. And we can't wait to celebrate with you as well. Peace and love. Bye.